Good afternoon everyone. Myself Dr. Priyanka. I will be presenting a topic of study of dry eye status in type 2 diabetics and its association with the severity of diabetic retinopathy. So as we all know, diabetes is one of the most common medical condition worldwide, and it has a life-threatening or debilitating complication in heart, kidney, brain and eye. So in the eye, diabetic retinopathy, cataract, glaucoma, keratopathy, chronic dry eye and refractive abnormalities are the diseases associated with diabetes. So etiopathogenesis of dry eye in diabetics can be explained as it is related to the peripheral neuropathy secondary to hyperglycemia, insulin insufficiency, inflammation, autonomic dysfunction and altered enzyme aldose reductase activity. Some researchers has also reported that diabetes induced histological alteration in lacrimal gland, hyperglycemia related oxidative stress. So, diabetic retinopathy is a leading cause of visual impairment in working age people, and it is related with the decrease in the perfusion of capillary bed in retina, and neovascularization will be developed to compensate the retinal ischemia. It has been emerging as a crucial outcome measure for clinicians to detect dry eye disease earlier and to look forward treatment in the early stages itself, so as to prevent the further adverse complication of dry eye in diabetic patient. So therefore, this study aimed to evaluate a dry eye disease in diabetic patient and its association with the progression of diabetic retinopathy. So aim and objective of my study was to estimate proportion of patient with dry eye disease in type 2 diabetes patient and determine its relation with the severity of diabetic retinopathy. So it was a cross-sectional study conducted from June 2022 to November 2023 in our department, and the study population was 100 patients with type 2 diabetes coming to our OPD. So we included all the patients with type 2 diabetes and above the age of 30-year-old. Then the patient with ocular disorders such as allergic eye disease, vitamin A deficiency, Stevens-Johnson syndrome, vernal keratoconjunctivitis, herpetic eye infection were excluded from our study. Also the patient receiving any topical treatment, having history of ocular surgery, also the patient having the systemic diseases like rheumatoid arthritis, Sjogren's syndrome and lupus erythematosus and contact lens wearer were excluded from our study. So observation and results includes among 100 patients with diabetes, 57 patients were diagnosed to have dry eye, and out of 58 patients with retinopathy, 45 patients, that is 77% were found to have dry eye, and out of 42 patients with no retinopathy, 12 patients, that is 34% had dry eye. So as we see in the graph, the incidence of dry eye was more in the diabetic retinopathy group. So based on OSDI's grading, 53% patient was having symptomatic dry eye. Out of that, 20% were having mild dry eye, 22% were having moderate dry eye, and 11% were having severe dry eye. So we also found a significant association between the diabetic duration and the dry eye. So in our study, the prevalence of dry eye in diabetic was 57%. In particular, diabetics with retinopathy had higher prevalence of dry eye than the diabetic with no retinopathy. So in our study, the mean age of diabetic with dry eye were 55.45 plus minus 8.32 years. So we also found a significant association between dry eye disease and duration of diabetes in our study. Longer the duration of diabetes, higher was the prevalence of dry eye. In our study, significant difference in Tibet and Schirmer test was observed in the patient having diabetic retinopathy. Based on the OSDI system score, among 100 diabetic patients, 53% patient had symptomatic dry eye, and the frequency of dry eye symptom in our study showed significant difference in the OSDI score between diabetic with retinopathy and diabetic with no retinopathy group. So adequate glycemic control could prevent the dry eye disease as well as retinopathy progression in diabetics. So a limitation of our study was limited sample size and lack of more objective tests like conjunctival impression cytology, tear osmolarity measurement. So to conclude, patients with type 2 diabetes have higher prevalence of dry eye. Evaluation of diabetic patient using OSDI questionnaire can helpful in identifying dry eye in early stages. Significant association was noted between dry eye disease and the duration of diabetes. significant reduction in the T-bird and Schirmer test was found in diabetic patients, especially in those with retinopathic changes. A positive association was observed between the severity of retinopathy and dry eye. So, a patient with advanced diabetic retinopathy are at increased risk of developing ocular surface complications. So, hence, our study insists that clinical evaluation of dry eye should be an integral part of ocular examination in diabetic patients. So, these are my references. Thank you.